So when talking about just generalities of what's an ultrasound system, what's a transducer, what are the specialties of them, at the end of the day, we can push all that aside. Image quality is the focus. This is the diagnostic quality of what the equipment can return to the user to use for diagnostic purposes for patients. And the main things that we'll be focusing on today, which is not entirely exhaustive of all the technology, but for the purposes of HTMs, these are the big ones. 2D grayscale. We'll be looking at color, which would be color flow, blood moving to and from the face of the transducer like we talked about before, and continuous wave or pulsed wave. And what this is this is really a kind of almost like a really sophisticated stethoscope that will tell you, blood flow and is really a sensitive piece of circuitry that will be the first usually to fail. And we want to teach you how to be able to identify that, because that failure would be then followed up by some more catastrophic failures that might not be repairable in the future. And to reiterate, when we're looking at the entire ecosystem of the ultrasound technology, any image quality faults can be the system or the transducer. A lot of people just jump to the probe, like I said before. Not the case. It could be either, and we'll help you identify and isolate which part it is. Is it the probe? Is it the system? And if it's the system, kind of what parts you should be looking at to diagnose the equipment failure. With all this talk about image quality, what the potential faults could be, we need to start out with, what does a good image look like? And we are so fortunate to have Carolyn Coffin, a Seattle University sonographer and professor, who is also an R&D specialist for image quality and ergonomics for many of the manufacturers all over the world in ultrasound, is going to help us identify and look at what a good image looks like. So please welcome Carolyn.
Hi, I'm Carolyn Coffin. I'm a sonographer and an ultrasound educator. And I'd like to talk to you about what sonographers look for in their image. It's important that you understand how they image and what presets they use and how they make a diagnostic image. The first thing is the continuity of the image. Is it the same shade of gray all the way through? And are there any areas where they're not seeing a nice homogeneous pattern? The next thing is resolution. This is a high frequency transducer, so you would expect the resolution to be good. You want to be able to resolve all these little pins individually as much as possible, even the ones that are close together. This is important because small structures in the body need to be seen separately. And then you want to make sure that the resolution of larger structures are clear and that the homogeneity of the echoes is also constant. So you have an area here that has no echoes, that's anechoic, and then you have different degrees of echogenicity depending on what the structure is. This one is echogenic, and you should be able to see that. So we're looking for a consistent image that is smooth all the way through, has no areas of dropout, because if there are areas of dropout, you lose information that could be diagnostic. And you want to make sure that the resolution is the best it can be for the transducer in use. Now, for color and for pulse Doppler, the same thing applies. So I'm going to go here. This is a high frequency transducer and one that you would use for carotid arteries and for superficial structures. So let's look at a carotid artery. So here it is, and the key to this image is to have a nice black or anechoic blood vessel again, with no areas of dropout and no areas where the vessel is being filled in or where there's reverberation. And then let's put color on. So the color should fill the whole vessel. The color scale should be such that you don't get a lot of blending of colors, blue, red, all together. It should fill the whole vessel, as it does here, and there should be no areas where there's speckling or a line through the color that would indicate a broken crystal. Again, that would be dropout, and you don't want to artificially create something in a blood vessel that isn't there. And then we put pulse Doppler on. And you can see the important thing is to have the right amount of gain so that the window of the vessel is not filled in. Here's too much gain, which is not what you want. And here's an adequate amount of gain, which shows the vessel with the open window and the nice outline of the blood flow. Again, any areas of dropout or any areas where there's a loss of diastolic signal could indicate that you have too high of a wall filter. So it's important to get both the systolic and diastolic components. This image is with the 2.5 sector transducer, and we're looking for the same things. We're looking for the homogeneity of the tissues. We're looking for the little cystic structures and the solid structures, but we're also looking for penetration. So at this frequency, we should be able to penetrate clear to the back of the phantom, which we're seeing here, which doesn't happen with the higher frequency transducers because they're more for the near field. We also want no areas of dropout, just like with the linear, and we want resolution to be fairly good, but with a lower frequency transducer, the resolution isn't going to be the same. So you can see the pins in this one. The ones that are spaced farther apart have good resolution, but the cluster of pins don't have quite the resolution, and that's to be expected with a lower frequency transducer. So it's a trade-off between resolution and penetration. But with this transducer, what we're looking for is to get a good penetration to the deepest part of the structure, which is important when you're scanning an organ such as the liver. And you can see the bottom of the phantom in this one. So all the imaging parameters should be the same, but you do sacrifice penetration with a higher frequency and resolution with the lower frequency.
Thank you, Carolyn, so much for taking the time to help our students out on how a good image should look like and how to acquire it. And just to recap, a good air scan, no gel on the left-hand side picture, good CW, nice waveform, no spiking, no missing information. And on the right, if you have a phantom, a good phantom scan with a nice, clean, image of all of the objects inside of a phantom, but also a nice even image, specifically vertically. And when you were talking about a phantom, this is one of the phantoms we use. We use a Gamex. These are calibrated, they're calibrated on a regular basis. But inside you can see, not inside, but inside, there's a pictorial representation of what is on the inside. And what these mean is these are calibrated to say, hey, you should see all these things when you image, and you'll see specific penetration on certain probes. Obviously, the lower frequency can actually see to the bottom of it, but you can also take measurements to see how accurate your image is. And we typically don't see things out of whack here. This is just really confirmatory to take measurements inside the machine during testing and validation that the probe is functioning properly. But yes, these Phantoms, there's very many kinds out there. Highly recommend you get one for your shop and to use that to go test probes out there with the sonographers. And now we wanted to have a theme about what are the image quality faults that you would be seeing out there in the field. And this isn't exclusive to the Philips Epic machines. This is, just in general, what are the common failures that ultrasound machines in general will suffer from. And here's a few examples. We'll get in some details later, but when you see image quality, again, it can be the system and it can be the probe. And now that we have really an overview on what a good image should look like, let's jump into what some faults are that you're going to see out there in the field. This is an example of an extremely common failure, and it can be the machine or the transducer. And I'll give you a quick little tip on how to identify if it's the probe or the system here in a minute. But to describe what's going on is you see this black area here that I'm circling. This is a dropout, and this is really missing information either from the probe or the system, which is not giving any reflection back. So the idea here is that either the crystal's not emitting the sound for any sound to come back, or the reception of the sound, that circuit is failing and it can't listen. And so basically, for one reason or another, the information isn't getting back to the machine to display on the monitor. And in this particular case, you can see that we're moving a bit on our Phantom here. A Phantom is a calibrated device that has a bunch of objects in them, whether they be pins or metal tubes, or it's made of a variety of things. But it allows the scanner to have a consistent scan surface and scan body to really check to see if there's any issues with the transducer. And here you can see that there is movement in the screen, and you can see that we're rocking the transducer back and forth, and you can see that this particular dropout isn't moving with the transducer. Really important here for a troubleshooting tip is that when you move a transducer across your Phantom, or if you're scanning yourself and the dropout stays exactly where it is on that image, it is likely a machine issue. Something in the channels, either sending or receiving on the machine side, is not propagating that data in that specific section. Now, if that dropout or that shadow moves with the probe as you're kind of rocking it back and forth or sliding across the Phantom, then that is indicative that it is a transducer issue. So just kind of wanted to tap on that right now, because this is a theme to really help you identify and diagnose quickly and accurately if the dropout is a machine or a transducer failure. In this example, we're going to talk about 2D dropouts with an air scan. The first question you're going to have, what is an air scan? This is simply a transducer hooked up to an ultrasound system, and it's scanning air. There's no gel, no body, no Phantom, and what this is showing is that there is a significant amount of dropouts here. You can actually see them going in and out, and for this particular case, this is likely a transducer issue. With the elements kind of, you can see them really intermittently coming in and out very quickly. It looks like it may be a multiplexing issue here that's failing on the transducer, but this is a pretty severe failure here and something that you want to look out for. And Another tip for you to identify if this is a transducer failure or a machine failure, a really simple technique: move the transducer from one port to the next port. If it fails on one port, but it doesn't fail on another port, you have a transducer select port failure. And so that will allow you to quickly diagnose accurately if it's the probe or if it's a system. I can't stress enough on this technique, along with the scan that we just talked about in the previous slide, on identifying if it's the machine or the transducer. So two things: does the failure in the image follow the probe when you move it from side to side? And if it does, move the actual probe to another port. And if the failure is exclusive to the port, because when you move it to another port, it is okay, then you have a machine issue. Now here's CW noise with an air scan. And CW is continuous wave, and oftentimes the most sensitive circuit in the entire ultrasound technology ecosystem. And what we're showing you here is that with no gel, no phantom, you're not scanning your body, you're just simply scanning air, we are getting these spikes in the CW. This is a very common problem, and specifically with the Philips Epic machines, you will get this problem fairly common with the X51 transducers and the acquisition module, which is a part inside the Epic machine that we'll talk about later. But this is a fantastic first stop to see if there's any failures in any circuits in the ultrasound system and probe by looking at the CW, because this by virtue is likely the most sensitive circuit in the entire technology that we're talking about here today. And so if you have CW noise, it is likely going to turn into dropouts. It's likely going to turn into color noise down the road. And this is something that's very repairable. And if you catch it early, you avoid a lot of downtime, and you can avoid a costly replacement and just simply getting it repaired. And the last really common failure is color noise with an air scan. And so if you look at the circuitry in its totality for a probe and a system together, the main modes where you will see failures are going to be the 2D that we talked about, the CW noise we just talked about, and now color. And with color, obviously an air scan again here, and there's nothing on the probe, and you're seeing these lightning strikes and these spikes of color. And what this is telling us is that there's too much information here. And so, when there's these micro fractures in these circuits, the circuits will sometimes move. And then when they come back together, there's like a bang when it comes to that data transmission, and you see that in the color noise here, where there's just too much information. It's inaccurate for a diagnosis. Another way that this could occur is that two circuits that are supposed to be isolated from each other actually short together. And so they temporarily short, they go apart, they temporarily short, they come apart. And that's another way that this CW noise, color noise, can propagate in your image, and what we're seeing here. So now you students are armed with what a good image should look like, what the most common image quality failures are, and at this point, we want to take a moment to really emphasize that all the technology that we're going to talk about and the hardware revolves around image quality. The ultimate goal is to have a good image that has accurate information and complete information to give a diagnosis for the patients, but also with good running equipment, it increases the efficiency of the sonographers on these machines. When there's image quality issues, oftentimes they can navigate these issues. However, it slows them down. And so having this equipment performing the way it should be actually will increase their throughput because it makes image acquisition so much easier. You're not trying to get the machine to compensate for this image quality issue or fault, or trying to get a 2D or a dropout in a certain section off of the image for them to capture the proper image they're looking for in a different area rather than dead center. It just really allows the sonographers to do a fantastic job, and they'll do a better job, and it's faster.